Eye-hand coordination, also known as hand-eye coordination, is the coordinated control of eye movement with hand movement and the processing of visual input to guide reaching and grasping, along with the use of proprioception of the hands to guide the eyes. Simply, hand-eye coordination is the ability to do activities that require the simultaneous use of our hands and eyes. Eye-hand coordination is a complex cognitive ability as it calls for us to integrate our visual and motor skills. This skill is especially important for normal child development and academic success, but is also an important skill that adults use in countless activities on a daily basis. Hand-eye coordination is an important component in sport, handwriting, reading and play, as well as in life care activities. We use hand-eye coordination whenever we write. As one starts to make lines, the eyes send visual information to the brain to tell us where the hand is in place and how it is moved in order to create appropriate lines and shapes, resulting in letters. A similar sequence takes place when we type on a keyboard, drive, play sport, insert a credit card, and put a key in a lock. Chances are that you've never really thought about hand-eye coordination unless this is an area in which you experience difficulty. If this is the case, you will realize that hand-eye coordination is important in almost everything that we do. While hand-eye coordination would obviously be affected in the case of deficits in either the visual or motor control areas, it is important to note that hand-eye coordination can work poorly even if vision and motor skills work properly. In many cases, the difficulties lie in the integration of these two skills. Difficulties in the skill can affect many different activities, which may lead to developmental disorders or learning disorders. The child may have difficulty learning to read and write and play sports. Academic performance is commonly affected, and these children often make mistakes when taking notes, display poor handwriting, and demonstrate weak attention. In adulthood, professional areas are likely to be affected, particularly if there are problems typing or assembling objects. More disruptive than any of these consequences, however, is the general impact on self-care. Hand-eye coordination problems are usually first noted as a lack of skill in drawing or writing. Drawing shows poor orientation on the page, and the child is unable to stay within the lines when coloring. Often the child continues to depend on his or her hand for inspection and exploration of toys or other objects. When a child is between 1 and 2 years old, parents should start encouraging activities that allow the child to learn how to use hands to manipulate objects and learn how different things fit together. These activities are extremely important for the development of hand-eye coordination, which is crucial for the overall physical development of the child. Some toys are designed to assist hand-eye coordination development. They usually involve fitting things together, but parents can also use simple kitchen cups or bowls. Allowing children to play with these objects teaches them how to fit objects together. Jigsaw puzzles are also good hand-eye coordination developers, as are blocks or tower toys that encourage playing and coordination. These toys help children learn that items can fit on top of each other and which ones will stack easily. By the time children reach 2 or 3 years of age, they are ready to start throwing things and wanting to catch them. These play activities are a great way to improve hand-eye coordination. Threading and lacing also works on this skill. Most child development professionals believe that the best thing parents can do when trying to improve hand-eye coordination in their children is simply to let them play with a variety of toys on their own. As children get older, paper-based tasks such as mazes, dot-to-dots, and tracing can also be used in order to develop this skill.